Hi, and welcome to Split Screen, a production of Love OV presented by Harvey Goodman Realtors and ClickHarvey.com. I'm Nick Nash, your host, streaming live from the Love Lounge, actually our third location just this week. They keep moving the Love Lounge from room to room. Pretty soon it's going to be in the lunchroom, which is actually where I'd rather be. There's a snack machine in there. But for today, this is our Love Lounge, and welcome to Split Screen. Big thanks to Harvey Goodman Realtors and ClickHarvey.com for jumping on as partners of the show. If you are looking to buy or sell a home, you can get listed quickly with ClickHarvey.com. If you're looking to buy, there are hundreds of homes for sale in the Ohio Valley right now, waiting for you to check them out at ClickHarvey.com. If you're looking to sell, they can make it super easy. You'll find all the info and resources you need to get listed very, very quickly and very, very easily. ClickHarvey.com. Big thanks to Harvey Goodman Realtors. Let's jump into our show today. We've got a special one. Our guest by the name of Kristy Good. She's from Coleman Professional Services with location in Steubenville. Hi, Kristy.
Hi, Nick. How are you?
Doing well. Thanks for joining us.
Thank you for having me.
Okay, so Coleman Professional Services, I'm going to be honest, I was not familiar with you guys, what you do before we started the show today, or at least until about an hour ago. I was reading up a little bit about you guys and what you do, but I'll have you explain it. What exactly does Coleman Professional Services do for the area?
Sure. Coleman Professional Services has been in Jefferson County since 2015, so we're at our 5-year mark. So that's really good. We offer comprehensive behavioral health services here in Jefferson County. So we offer an array of services from counseling, psychiatry, case management, along with some other services as well.
Okay, so this is Coleman Professional Services. Your location in Jefferson County in Steubenville is part of a larger network all through, I think you said 9 counties in Ohio.
Yes.
I'm not going to ask you to name the 9 counties because I can't name them either. So, but it's part of a larger network, so a lot of resources there. What would somebody find at Coleman Professional Services that they would find helpful? What type of programs, what type of services are you offering?
Well, I would like to say, yes, we are in 9 counties in Ohio, and we've been operating for over 40 years. So in those 40 years, we've transitioned through the times, but in each county, you'll find Coleman looks a little bit different. We address the needs of each county. So what services look like in Portage County, they may not look like what they are in Jefferson County. So when we came into Jefferson County, we listened to the needs of what the community members wanted from us and adapted services in that manner. So what we offer is we offer a variety of services. Like I said earlier, we have psychiatry, we have counseling, we have case management. We also have 24-hour crisis services. So what that means is we can respond to community events, as well as if somebody presents in the ER with increased symptoms of mental illness. So if they're in crisis, we go in, we speak to them, and then field the assessment as needed. So what we would do is, if they needed outpatient services, we would make those referrals and connections and give them appointments for that. Or if they needed a higher level of care, like inpatient hospitalization, we could facilitate that for them as well. We also offer, we have a visitation center that we operate out of Coleman here in Jefferson. So those families that are struggling and need a safe environment to see their children and to do exchanges, we do that here as well. We have a guardianship payee-ship program. We also provide housing for homeless. We can take those individuals currently that are homeless and house them for up to 271 days. We also have a guardianship and payee-ship program that if individuals need assistance with management of their money or critical decision making, we can help do that as well.
Yeah. So there's a lot of services that you offer. There's a lot of things on the plate here. Just curious, how does one go about obtaining these services? If you needed like you said, therapy or a counselor or housing, something like that, how can somebody reach out to you guys and get help?
Sure. Well, a unique thing that Coleman does offer is we have prior to COVID, what we were referring to as our walk-in clinic has now changed to a call-in clinic. What that means is anytime a client needs us, we really focus on accessibility for a client. So anytime they need us, they can call us and many times get appointments that very same day. So they can call us, or they can still walk in as well, because we are still seeing patients face to face. And they can come in, we can get them into a schedule with a counselor. They can have that initial assessment done that same day, and oftentimes have counseling the very next day or within a couple days, or psychiatry services, whatever it is that they need. So we don't create, while doing that, we don't create that bottleneck of, we have to schedule you out in 3 months right away, and meet them where they're at and address their needs pretty quickly.
You know, I was going to mention that's one of the things that when during the discussions of mental health and services that are needed in the Ohio Valley, oftentimes one of the big complaints is, you need to see somebody. It's an urgent situation regarding mental health. Oftentimes you can't wait 3 months. You can't wait 3 weeks.
Right.
So to be able to offer that urgent care in a timely manner, I think is extremely important.
It is extremely important. We want to be able to be there for the client when they need us, and not push them out for 3 months when they've already possibly been through their crisis and have come out on the other side, or we just want to be there when they need us.
What are some, and it's touchy because obviously don't want you to divulge any, statistics or numbers or anything, but I am curious about some of the services and some of the major problems that face the Ohio Valley, not just the Steubenville area, but all the way up and down the river, that may be unique to some other areas of the country.
I'm sorry, could you ask me again? You cut out.
Sorry. I was just curious about, certain issues, certain topics that are have become issues in the Ohio Valley that you guys help with, that you've seen maybe in the Ohio Valley up and down the river that might be a little bit different from the rest of the country.
Sure. A lot of the pressing issue around here is just mental health awareness, and making individuals aware of our services, making them aware that there is help out there, and trying to remove some of that stigma. A lot of stigma related to mental health, and we want to remove that and make it as normal as going to a cardiologist. So I think educating our community on what mental health is, what some of the symptoms are, and just recognition of some of those symptoms, and bringing them into mainstream along with some of the other physical health problems.
I'm glad you mentioned the word stigma, because that was something that was on my mind. Is that I feel like when you think about the mental health discussion that's happened over the years, it's come a long way. I think even, especially in the last 5 years, maybe, as opposed to over the course of 20, 30, 40, 50 years, I think we've come a long way as a whole in opening that discussion and having those talks. Do you agree?
Yes, I agree. I definitely agree. Opening the discussion, making it more of a public forum, and having those conversations with our community members and with our individuals that we serve helps it to become, helps to remove some of that stigma. We've come a long way in the past several years.
Yeah, come a long way. And I still think there's a long way to go, but we're moving in the right direction. A couple of questions coming in on the comments section here from Jane. Do you provide transportation to and from appointments? That's a good question.
We do. We do arrange transportation to and from appointments. You would just have to come in, identify that as a barrier, and we can assist in getting you to and from appointments. Great question. Thank you.
Okay. What about insurance? Do you accept all insurance? What if you don't have insurance? What's the situation there?
I can't say a blanket statement that we accept all insurances, but we do accept Medicare, Medicaid. We also accept private insurances as well. And if you're not covered, we can help you take the steps that you need to find the right coverage for you. And if you can't be covered, there are other resources that can be tapped into to help get services and help get some of those services paid for, so we can be there for you when you need us.
Okay, so you offer assistance in getting all those things taken care of as well.
Yes, we do.
How many employees do you have just in Steubenville? I'm curious.
Just in Steubenville, we have 50 employees.
Yeah, that's a big number. That's a lot of people all working together to make those things happen.
It is.
Yeah. So, you mentioned we were talking before the show, you mentioned a crisis stabilization unit. And I told you, don't explain it to me now. I want to hear about it on the show. What exactly is a crisis stabilization unit?
So we've been working here in Jefferson for quite some time on trying to put together a crisis stabilization unit, and we actually are successful with that now. So crisis stabilization unit is a temporary residential treatment center that focuses on individuals that.
I think we lost our guest. We'll give a few minutes before she comes back on and see if she can get reconnected. We had an issue with that earlier this week as well. I'm sorry, but if you're still watching the show, our guest today is Kristy Good from Coleman Professional Services. And since she's not here, we are going to go ahead and hop on their website until she is able to rejoin. Oh, I think she's jumping on now. Let's see.
I'm back.
You're back.
I don't know what happened, but I'm back.
That's okay. We were actually just getting ready to jump onto the Coleman Professional Services website and take a look through there while you were trying to get reconnected. So, sorry. Anyway, you were talking about the crisis stabilization unit.
Yes, I'm not quite sure where I left off, but the crisis stabilization unit is a temporary residential treatment for individuals experiencing increase in mental health symptoms. So those that need our assistance are experiencing some higher levels of symptoms come in for temporary residential treatment where we can wrap services around them, being anything from individual counseling, group counseling, case management, peer support services, nursing services. It allows them time just to be able to come back to baseline and be able to, minimize some of those symptoms. So we treat individuals that don't quite meet that level of care for inpatient hospitalization, so they're not a threat to themselves or anyone else, and it's completely on a voluntary basis. So they come in because they want to come in and they want our supports and services. So that'll be located on the 8th floor of Trinity Hospital. Once we get up and running, we were 1 day away from completion of construction before COVID happened.
Oh, no.
Got put on hold. So we're waiting on the okay to get back in there, do the 1 day of construction, and then move through our licensure process, and we'll be up and ready to go, ready to accept patients.
Okay, good. You mentioned Mental Health Awareness Month, the month of May. Are you guys doing anything special for that, or is there anything that you're getting involved with?
It's been a little rough because of COVID, able to get out and about to involve ourselves, but we're staying in touch with as much as we can as far as getting our voices out there through interviews, through our Facebook and other media outlets, social media outlets, just to let people know we're there. We're updating our website to make sure that everybody can reach us as much as possible, and we're doing it that way through the COVID.
Okay. So, more generally speaking, what are some things that you think the public should know about this sort of treatment or this sort of the services that you offer? What's something that maybe people don't necessarily know about?
Primarily just that we're here. I know a lot of our recent goals have been to get our name out there, to let everybody know that we're here, to let everybody know that we've been open during the pandemic at your comfort level, so we can provide services, whether it's in person and you walk into the office, and again, you can receive those services right away. We can also do phone calls. We can do video conferencing, whatever, right now during the COVID pandemic, whatever the patient feels comfortable with, we're here to provide the services.
Okay. All right. Your website is colemanservices.org. And
Yes.
Again, this covers 9 counties in Ohio. So there's a lot of information on here. Do you have, maybe I know you have a Facebook page, but do you have like a direct phone number for the Jefferson County, anybody in the area that might be able to reach out to you?
Yes, for our office line, our main office line is 740-996-7100. That'll get you to our main office during operating hours. We also have a 24-hour crisis hotline, which is 740-996-7127. That will get you to speak to a counselor off hours. If there's something going on and you just need to speak to somebody, you'll be able to do that. Or if there's a crisis and you need further assistance, we'll be able to come out and see the individuals.
Okay. So what would you classify as a crisis? What would be a reason for somebody to call that number?
Actually, that really can be established by the person that's calling. So it could be anything from they're feeling overwhelmed from something that happened during the day and they just want to get it off their chest and have somebody, to speak to, or it can be all the way through somebody having thoughts of harming themselves.
Yeah. Okay. Mm-hmm. All right. Coleman Professional Services, located in Steubenville. We actually have a couple more questions coming through. Do you mind answering a couple real quick?
Sure.
Okay. Jane says, I see you can volunteer. What is involved in, and are you trained to do, or are you trained and do you have to be certified in CPR, et cetera? So what can somebody do to volunteer?
Actually, to volunteer, you would just need to call the main number that I had just stated, and we can get you connected with our HR person, and we can move you through the process. We love volunteers. We love anybody that would be willing to come in and help us out and help the clients out. And as far as CPR and first aid, that would be dependent upon which position you would be volunteering for.
Yep. And I noticed on your website, there is a volunteer button if anybody's looking to volunteer. It looks like there's info on there as well, colemanservices.org. And I would imagine this is Mikey from the LoveOV page. How has COVID seemed to affect those in need of your services? I can imagine isolation and not partaking in certain activities can cause increased illness. I would agree with that.
Yes, he's correct. So a lot of the effect has been the isolation, not being able to get out, not being able to go into the community, and it creates an increased fear a lot of times too of becoming sick, as we all, have felt over the past couple of months. So in order to combat some of that, we have, like I mentioned earlier, we have adapted and have been able to offer telehealth services to individuals that either are, worried about coming out and becoming sick, or other barriers as well that were prior to COVID, which might be some of those transportation barriers that someone had asked about earlier, maybe childcare. We were able to combat some of those barriers and still provide services. So some of the people that we weren't previously able to reach, we now have been able to reach and be able to provide services to those individuals.
Yeah. This is a question I had been thinking about, and it may not be quite up in your wheelhouse, but just curious, maybe you had an answer. How has the pandemic affected the homeless population?
As far as the homeless population, we're still offering the same services to them. So we also have at Coleman, we have a drop-in center, which is open. We have it open from 8 a.m. to 8 p.m. Those individuals can come into the center. They can launder their clothes. They can shower. They can have a place to come in out of the weather. And then that also gives them opportunity to talk to our staff as far as what their needs are. So if they're currently homeless and they want us to assist them in finding housing and securing that, we can do that with them as well. So our doors are still open for that service. And we also work with our community partners on the homeless shelters as far as assisting them in what their needs are as well.
But you guys are doing amazing work. You guys are really taking care of people, which is an amazing thing to see, especially right now. There's a lot happening. If anybody watching is in need of services or is interested in volunteering, the website is colemanservices.org. And Kristy, thank you so much for joining us on the show. This was a lot of great information. You guys are doing amazing work. So thank you.
Thank you. And thank you so much for having me and listening to what Coleman has to offer. Thank you so much.
Absolutely. I want to hear more about that mobile or that crisis stabilization unit once you get it up and running.
Absolutely.
Come back on the show. We'll talk about it. Okay.
Will do.
Okay.
Yes, no problem. All right.
Kristy Good from Coleman Professional Services, colemanservices.org. Thank you so much for joining us on the show. Today's split screen is presented by Harvey Goodman Realtors and clickharvey.com. If you're in the market to buy or sell a home, clickharvey.com is the one resource you need. You can log on today and find hundreds of homes for sale if you are looking to sell your home. They have all the resources you need, and they make it quick and easy to get listed. Harvey Goodman Realtors and clickharvey.com. That is split screen for this week. We will be back with you again on Monday. A production of Love